There are currently 34 million people with diabetes, or approximately 11% of the US population, and 88 million with prediabetes, or roughly 35% of the US population. This costs the US health system close to $500 billion. A key barrier in the management of diabetes is a failure to identify high-risk patients, treat them early on with effective medications, and normalize physiology. The multi-system involvement of diabetes and the traditional siloed approach to treatment often results in delayed, fragmented, and high-cost care delivery. We desperately need alternate models.
Now, founded in 1866, University Hospitals of Cleveland has been guided since inception by a deep commitment to patient care, community welfare, and research efforts that have changed the practice of medicine.
The goal of research is always to implement it and apply it to our patients. And ultimately the goal is to help patients live better, healthier lives. Here at UH, we have research spanning from the basic to translational, all the way to clinical research, as well as implementation science. We do this across several institutions within UH and Case Western Reserve, from the Discovery Center that looks at drug development, to our cinema program here, which is both a clinical and a research program to really look at risk factors and outcomes driving patients with diabetes and cardiovascular disease. So I'm a preventive cardiologist with an active clinical and translational research program focused on the heterogeneity of obesity and how obesity, and especially body fat distribution, can actually translate into higher risk for certain diseases like cardiovascular disease and type 2 diabetes. My research is focused not only on translating the basic research findings of my colleagues, but then also applying those into clinical trials and epidemiology to try to understand better visceral and ectopic fat, which is this primary driver for all the obesity-related diseases that we see.
We have established centers of excellence that serve as a key mechanism by which our institution seeks to fulfill its vision of advancing the science of health and the art of compassion.
Since its creation a year ago, cinema has ignited a national conversation on how to innovate in the space of type 2 diabetes and obesity. Cinema began as a transformative UH-sponsored center of excellence to revolutionize clinical care research and education of the patient with cardiometabolic disease.
The cinema program it focuses on patients that are diagnosed with vascular disease, type 2 diabetes, and also obesity, and it tries to help patients to be able to manage their glucose level.
First, our nurse navigator contacts the patient and is a comprehensive history of their medical issues, concerns, and medical comorbidities. We then schedule them for a virtual or in-person visit with both our provider, who is a comprehensive care specialist both in cardiovascular disease and diabetes, as well as our certified diabetes educator / nutritionist, who really takes a comprehensive approach to lifestyle modification and medical therapy. During this virtual or in-person visit with the patient has the opportunity to ask all the questions and address all the concerns they have in a comprehensive fashion, and specifically how their diabetes integrates with their cardiovascular disease and how treating one may treat the other, and really take a systemic approach.
My current care with the cinema program has the one-on-one interaction with the nutritionist, the physician, and also the nurse, so I'm able to ask the many type of questions I have.
Cinema is a unique test bed of simulation environment to implement new personalized medicine initiatives. We are working on rapid adoption and translation of next-generation technologies for metabolic disorders. This includes emerging imaging methods, point-of-care diagnostics, biomarkers, and e-technology solutions, and finally genomics from the personalized medicine perspective.
Our goal is that by the second cinema visit, 3 months later, that when we repeat their laboratory work and we meet with the patient, that they feel better, their health is better, their numbers are better, and that overall they have a better understanding of their diabetes and cardiovascular disease, how to then take that approach for sustainable long-term improvements. That's the goal of our cinema journey, and that's what we like to work with patients every day on.